Metropolitan Pandemic Task Force has put out these charts. We are continuing to see hospital admissions be down. I'll show you this, just, I don't know how well that comes through, but you can certainly get to this on the St. Louis Metropolitan Pandemic Task Force Facebook account. 3 o'clock this afternoon, there'll actually be some new numbers for that. So we continue to see a downward trend. The trend in hospital admissions has been trending down. It's been down, this is a 7-day rolling average, trending down for about the last 2 weeks. And so we are mildly pleased with that, I think is the way you would say it. Of course, you don't want anybody to be sick, but we are embarking on a time frame where we are going to have to learn how to coexist with COVID-19, and that's what we're all working on each day. You know that on Monday evening, today's Wednesday, I haven't really talked a lot about this. On Monday evening, around 6 o'clock, we released the standards and the guidance for in each industry sector. Let me get this book here. So I had it printed out just because it's easier as a reference document, but all of these are online. Anybody who hasn't seen these standards yet, please go online, just go right on the city's webpage. It's right on the home page. And what you will see are guidelines for reopening offices, for reopening commercial office buildings, for reopening hotels. Hotels have been open, but additional standards for hotels, for manufacturing, for retail, for restaurant, for personal services, and for transportation. So this was developed by an intense process by the working groups that were made up of members of each industry, as well as the doctors from the St. Louis Pandemic Task Force, Dr. Eccles, who heads our health department here in the city of St. Louis, and St. Louis County. So we came together on these standards, which are 99.9% the same in St. Louis City and County, which I think is a real plus for the people that we're all trying to serve, which are our residents and our businesses, so that everybody can understand what the expectations are about opening, easing the door open, cracking the door open on Monday the 18th. We do know that many businesses will remain closed then, even businesses that are allowed to open. Many of them are not going to be opening on Monday. They may feel they may just want to wait and see how this goes and open a few days later or a week later. There's no requirement for any business to open on Monday. There is many requirements that if you do open, you have to follow the standards, which will enable the 6-foot distancing, enable have your employees wear masks, encourage your customers to wear masks. Reaching for my mask, I've been wearing this one today. This is just a cloth mask, which is easy to wear, and so that's happening on Monday. But business owners get to make that decision themselves. The other thing that I would say here is that it's really important that we all wear masks. If you're going to be outside and it's unpredictable as to whether or not you might be able to stay 6 feet away from another person, then really you should be wearing a mask. So I hope that you will all encourage folks to do that. One of the things that we are rolling out tomorrow morning is sort of a starter pack of PPE, which is masks and gloves for, oh, here it is. I've got a sample here. A starter pack for small businesses. So businesses with 10 employees or less. We think most businesses, large businesses, we know they have been able to buy masks, buy gloves, buy the things that they need. But a business that might have 1 employee, 1 to 10 employees, may not have masks yet. So this is just a little starter package. It's got some instructions here that talk about, wear a mask in public, avoid touching your eyes and nose, practice social distancing, wash your hands with soap and water for 20 seconds. And what it provides here, it's probably hard to see, but 20 gloves and 20 face masks, surgical face masks. And it's just a starter kit for small businesses who may want it. To register to get a starter kit, all you have to do is email Restart St. Louis, RESTART STLOUIS at stlouis-mo.gov. There are 3 distribution sites that open tomorrow morning at 10 o'clock. One on North Kings Highway, 1408 North Kings Highway. We've got the addresses here. One at 3115 South Grand, and then one at 1520 Market, which is a city building right here in the center. So one north, one south, one right in the center. Businesses can go there tomorrow between 10 and 2 at the north and the south site, and between 9 and 4 at 1520 Market. That's a city building. So folks can go there to pick these up. You do need to register because we need to be sure that we can account for what we gave out. So please register. It's very simple. Doesn't require any private information, just the name of your business, your name, your email, phone number, no social security numbers, no federal ID numbers, nothing like that. But we do need to know who we're giving them out to. So please register, go online and register. And we're going to give those out for the next couple of days, Thursday and Friday. So that's a start on businesses. Are we ready with questions yet?
We do have a couple of questions,
Okay.
Mayor. Emily's watching and wants to know, is there going to be additional guidance for hosting summer camps?
So child care facilities, as you may know if you've read this, if you've taken a look at this guidance here, are able to open if they follow the CDC guidelines. The CDC guidelines are very good under the heading of child care. Now, summer camps is something that we're working on right now with various people in that business, as well as our school partners and our child care partners who we have regular conversations with. The city's recreation centers are not going to have recreation programs this summer because we just do not feel that we can run those programs and socially distance young people. Our pools are going to be closed this summer, unfortunately. And as I said on Monday, I think it was, I hope I get to change my mind on that, but right now that looks unlikely. There's still a lot of COVID out in the community. There's still a lot of virus. Everybody still needs to be careful. And a pool deck with, people running and playing and that kind of thing, a lot of touching is just not a place that the doctors think is a good idea to open for this summer.
A question, Mayor, from, oh, sorry, were you
No,
done?
that's good.
Okay.
I'm done.
A question, Mayor, from Bridget, who's asking about a date that we anticipate for gyms to be able to reopen. And she also follows up and asks, is it possible that gyms could send the city an example of what they can do to help reopen when they're able?
Yeah, Bridget, thank you. That's something that I said on Monday because we had a number of questions from both people who want to go to their gym and people who operate gyms. We are in conversations now with some of the gym community, and it's being headed up by our group that's worked on all of these standards. Please do send us what you think those standards should be. We know that gyms are places where people are breathing hard, just, spreading possible germs, where they're sweating, where there's a lot of equipment. So that's why gyms are not open, not able to open right now. I just think it's, the doctors really just think it's not time to do that. But certainly we want your input, so please do send it to Restart St. Louis. and send us what you have. Certainly we'll take it into account and look at it in terms of when gyms might be able to open and under what conditions. And I know there's a lot of, I did a Facebook Live this morning with the business community for about an hour and a half, and there were a lot of questions about gyms, and a lot of people who think, well, I'm not really a gym, I'm really something else. Like I'm really a yoga studio, or I'm really a Pilates, or I just have a small gym. So those are some distinctions that we're trying to work out right now.
On the topic of pools and summer rec, Dennis is watching and wants to know if the city will consider opening athletic courts such as like tennis courts.
So what the new order says, Dennis, is that parks will stay open, playgrounds will stay closed, and contact sports, those courts will remain closed. So tennis is not generally a contact sport. We have not made the decision yet as to whether or not we're going to open our city tennis courts. That's something that we're going to work on here in the next couple of weeks. But we have not prohibited other tennis courts from being open because it's not a contact sport. But soccer is a contact sport. Handball is a contact sport. Basketball is a contact sport. And those courts will remain closed in the city.
A question from Public Radio, Mayor. There are multiple parts to it, though.
Okay.
First,
Public radio is always going to have a multi-part question.
But they're pretty good.
Thank you, Public Radio.
But they're good questions. How many phases, so we can repeat, how many phases of reopening are there?
There's only one right now. There will be more, and I know you want to know, will there be 2 or 3 or 4 or 5? And we don't know the answer to that because we just don't have the health data to say that yet.
What are the parameters of each phase, including which businesses can open and how large the gatherings can be?
Mm-hmm.
And the standards for moving into the next phases.
Mm-hmm. We are continuing to work on all of those subjects. We've just come off of trying to figure out who can open in phase 1, but we will be continuing to watch what happens with number of cases, yes, but we expect we're going to get a big increase in the number of cases because we finally have more tests. We don't have as many as we'd like, but we have more tests. So we're watching that. We're watching the percentage of positive tests based on how many are given, and we're watching hospitalizations. So all of those things will be taken into account before we go to phase 2, or we may be doing this just a little bit at a time. It might not be literally a phase 2. It might be, okay, now such and such can open, and we base that decision based on what their operating procedures will be or they've committed to, and based on what we're seeing in the data. So I understand that you want to know the answers to all those questions, but we just don't know them yet. We have to take a go slow approach here and see what happens. And it's not just what happens right here in the city of St. Louis, but what is happening in St. Louis County, what's happening in St. Charles, Franklin, Jefferson counties, what's happening in Illinois, because we're all a region and we're a very mobile region. So I understand your questions. We don't have the answers to those yet.
Can you reiterate for Kristen, who's watching, where the public can view the hospitalization data that you shared at the beginning?
Yes. Did we post it on?
I don't know if we posted today's.
The best place to go is the Facebook page for the St. Louis Metropolitan Pandemic Task Force. Long name. St. Louis Metropolitan Pandemic Task Force. They post there every single day. And that's where these charts came from, these from yesterday. So that's the best place to go see those. And most days, not every day, but most days, Dr. Garza, who's the incident commander for the St. Louis Metropolitan Pandemic Task Force. Most days he also gives a verbal update as to where things are.
A question about how many people have been tested in the city so far and how that compares to when our stay-at-home order went into place in March.
I don't know the answer. I don't know those numbers. When the stay-at-home order went into place in March, there had been very few people tested. Today we're testing more and more, and that's a number that I can get for you. I will tell you that about a week ago, that number was that there had been about 8,000 people tested in the city of St. Louis, but that number is a week old, and so that's a number that I will try to get for you. We actually have to get it from the state, believe it or not. We get it from the state because there are so many people now doing testing. All these federally qualified health centers, Quest, LabCorp, the hospitals. Do you have it there?
I had for the state 124,000.
Yeah, we know the state number, 124,000 as of yesterday had been tested. But what I would really like to know here, and I don't think it's, well, let's see, cases, that's case count. Let's see,
That's percentage of positive cases.
for the whole state. Yeah, for the whole state, the percentage of positive cases is, well, it's so low here. Last time I looked, it's around 5% of the people tested. That's just the people that have had tests. And I know that what you want to know, and frankly what I want to know, is what is it county by county? And unless they've posted it recently, Kyle's going to look for it right now. I don't think we have that data.
Two people are asking about when will the DMV and City Hall open, because there are a couple of folks looking to renew their license plates.
It's going to be sometime in June. We are not opening City Hall to visitors on the 18th. We are going to be bringing some workers back on the 18th, and we're looking at about 2 weeks later. This is not an announcement. I'm just trying to tell you what we're thinking here while we continue to look at the data, but perhaps early June.
A question, and I don't think we're doing this, but why are we allowing malls to open? I don't think we have any malls, but I don't know what the county's doing.
For good or for bad, there are no malls in the city of St. Louis. So that isn't one of those questions that we have to answer. I do believe that St. Louis County is allowing malls to open. That's what it says in the reopening standards and guidance here. So it has to, stores still have a lot of protocols that they have to do with regard to testing their employees, with regard to 6-foot distancing, with regard to putting plexi or some barrier between the customer and the person where you're paying, the pay counter. So there are a lot of those things that have to happen under the new standards. But the city doesn't actually have any malls, any enclosed malls.
Chris's question, Mayor, is what do you tell employees who just do not feel safe about going back to work on May 18th?
City employees? All
It
employees?
says employees.
Employees. I think to some extent you have to make that decision yourself. If you have an underlying medical condition and you don't, you're not comfortable going back to work to possibly be exposed to more people, I understand that. Maybe your employer will change your job duties so that you're no longer interfacing with the public. So I think that I understand that. I mean, we've had a number of people in the city of St. Louis who have retired. They're able to retire, and they said, now would be a good time. They don't want to come back to work. That's a trouble for, difficult for delivering services, but it's certainly a point of view that I can understand for some folks, depending upon their health conditions.
A couple of parents, I think, are asking about whether or not a decision has been made regarding schools come fall.
There's no decision regarding whether or not schools will open this fall. Will Pinkney is the individual in my office who's the Director of Children, Youth, and Families. He is on, I think it's twice weekly phone calls with the school, not just St. Louis Public Schools, certainly they're on the call, but also the charter schools, also the parochial schools, private schools, all really talking about that. You know, it's what, the 13th of May. Most schools would not have even been out by now, or if it was now, it'd be just, you know, coming up. And so, you know, 3 months from now is a long time. We've been in this pandemic now for not quite 2 months in the St. Louis region. And 3 months until school starts is a long ways. And I know that schools are struggling with that decision, and many of them, most of them, are waiting to see what happens in the next month or two before they decide that. As a parent, that is very tough on you, I know. And frankly, most parents that I've talked to, my kids are not school age anymore, but most parents that I've talked to, their kids are ready to go back to school too. You know, this was fun for a little while. It was like a little extended snow days, but now they're missing their friends, and, you know, even doing work from home is a challenge. We all know that.
Carrie is asking, Mayor, if we eventually, or have we seen the 14-day downturn in cases that we previously talked about?
We have, and we're looking at it as 7-day rolling averages. We've seen that for a couple of weeks since the peak, which was about on the 25th of April. The reason we look at it sort of the 7-day rolling averages is that sometimes case counts, maybe a lab doesn't report their cases for a couple of days too. So we're looking at that on a 7-day rolling average. That's what the St. Louis Metropolitan Pandemic Task Force, Dr. Eccles, and the county's health department continue to look at.
A follow-up question to the PPE about small businesses. Will the city also be providing PPE to low-income individuals who may not have access to hand sanitizer, gloves, and or masks?
Yeah, thank you for that question. So it was just last Friday that we, the city of St. Louis, got a big shipment of masks that we had on order for weeks and weeks. And so we are now working with the Housing Authority. We are working with the folks who distribute Meals on Wheels. We're working with senior buildings for senior age people, working with all those buildings to help distribute a couple of masks to each individual. We're doing some packaging right now because we know that especially some of the senior buildings, you know, they can't get out and get masks. The other thing that's happening is our health director, Dr. Eccles, is working directly with nursing homes, assisted living facilities. He's been to many of them to make sure that they have the PPE that they need, and to make sure that they understand about infection control and how to run their business in such a way that they can tamp down the spread of COVID.
What is the goal of expanding testing and testing more people?
The goal of testing more people is to identify who's positive, quarantine or isolate, I think is really the word if you're positive, isolate the person who is positive, find out who he or she has been in contact with, in other words, contact tracing, you keep hearing that word, and quarantine those people. So you isolate the positive individual, you quarantine the folks that are asymptomatic, have not tested positive, but they've had a significant exposure, meaning within 6 feet for more than 10 minutes. Quarantine those folks to see whether or not they develop the COVID symptoms and therefore need testing. So the point is to identify folks, to isolate them. When you isolate and quarantine, then you stop the spread. If we didn't do that, which is of course we didn't have them in the beginning of this, then folks that are walking around with it and don't know it, there's nothing, you know, they're not intending to do this, but then they are spreading the virus without knowing it. So that's the point of testing more people.
A couple of questions regarding bars and restaurants and the kinds of establishments that will begin to softly reopen on May 18th, including places that have buffet style and then bars that don't have food.
Buffet style's out. And again, go to our website if you're really interested in restaurants, please. It's not that many pages, I don't know, it's 5 or 6 pages of, you know, what to do with your employees. I'm gonna pull it out since we're talking about this. Put my glasses on here. So restaurants, restaurant operating procedures. First of all, you've got the 4 main things. Practice social distancing, monitor your employee health, use protective equipment, clean, sanitize, disinfect. Those are the 4 big picture things. And then it goes into how to help a restaurant do those things. In other words, restaurant responsibilities to their staff. Goes through taking temperatures, wearing masks, make sure to give your staff training on cleaning. There's a whole number of things. The second thing, staff arrival and departure. How do you do staff arrival and departure when you're getting ready, when you're opening your restaurant? Screen folks, temperature check, ask them questions, what to do if someone answers yes or has a temperature. They go home. That one's simple. They go home, but they contact their medical professional. Then restaurant preparation. You know, interior and outside. What bleach solution to use. Hand washing stations in high traffic areas. Then there's a lot of those. Limit group size of tables. Make sure that if you have booths, for example, that there's a plexiglass or other solid material up at least 5 feet high between booths. Cleaning and sanitizing, protective equipment, there's a whole lot of things here. So those are the kinds of things that restaurants have to be able to do to open on the 18th.
Tracy's question, Mayor, is how bad is the budget and how long will it take us to economically recover?
The budget is bad, Tracy. It's really bad. It's over, you know, from March when this started through next year, which next fiscal year, it's maybe $120 million bad, meaning we won't have that revenue. We don't know the answer because none of us know what's going to happen. Pardon?
What was that number again?
120 million. Yeah. Give or take. None of us know how many people are going to go back to work, how many businesses are going to go open, how many people are going to go back to work and therefore pay earnings tax, how many people are going to go dine out or go shopping and therefore pay sales tax. We just don't know that yet. And until we reopen and we begin seeing whether or not we can reopen, and I'll tell you what, it is going to be very dependent on how many people will wear masks. Because for people who won't, and I know there are unmaskers, I call them, or non-maskers, I say steer clear, because a mask is, being distant is the best, but the second level here is wearing a mask. So how long will it be until we recover? You know, it took years before we recovered from the last downturn. If you remember the foreclosure crisis 10 years ago, it took years to recover from that, and I expect it'll take a good while to recover from this.
So you have a lot of people watching who don't think it's a good idea to softly reopen on May 18th. So I don't know how you want to collectively address folks who just think it's a bad idea and that we're not ready for May 18th.
I think that's a really valid point of view, number one. And I think there's a couple of things. One, businesses don't need to reopen on May 18th. They can. But you also don't need to go. If you don't think that's a good decision to reopen, then make sure that you won't want to patronize those businesses, shop at those stores, or eat at those restaurants. If you work at one of those businesses that is reopening and you don't want to go back to work, you're afraid to go back to work, or you're concerned about going back to work, then I think you've got to work that out with your employer. Uh, if you have underlying health conditions and you don't want to go back to work, then, you know, in all likelihood, and I'm going to direct you to, the webpage went down here, let me find it again. I'm going to direct you to the Missouri Department of Labor, and I just hung up from a phone call about an hour ago, maybe an hour and a half ago, with Anna, what's her last name? Anna Way, who is the head of the Missouri Department of Labor, trying to talk through different scenarios about unemployment, because I know that unemployment, the state's unemployment, along with the pandemic unemployment, the $600, is in the neighborhood of, it's over $900 a week for most people.
Medical update by Dr. Ezike. Doctor?
Every day to make sure that all of our food is safe whenever we go out to eat, who investigate pertussis outbreaks or measles outbreaks. They help in certain situations to provide vaccines to protect children from dozens of preventable illnesses and so many things. Local public health officials are working to keep us safe and are making decisions based on science. They're using studies from national and international health organizations and using the lessons learned from around the country and throughout the world to deal with this virus. As we continue to fight this pandemic, it has become so clear that there are no clear black or white answers. Everything is in shades of gray, and public health officials are working tirelessly to navigate this novel virus while balancing what needs to be done to keep people healthy and keeping in mind the very real consequences and the real sacrifices that people are suffering through as we endure this virus. Public health officials and the local health departments that they serve and lead are not the enemy. Let's remember that the virus is. So please understand the pressure that these dedicated workers are under. And with that, let me move on to the statistics from the last 24 hours. Today, we are reporting 1,677 new cases of COVID for a total of 84,698 total individuals with COVID-19 here in the state of Illinois. Unfortunately, our death total is at 3,792, of which 192 were reported in the last 24 hours. This is the largest one-day increase that we have reported thus far. Our testing capacity is increasing statewide, and we encourage healthcare workers, first responders, correctional employees, people with chronic illness, and those who are critical infrastructure employees, such as grocery store workers, truck drivers, and anyone who works for an essential business to get tested. In addition to the over 250 testing locations across the state, there are also 7 community-based testing sites, including the most recent one that opened in East St. Louis, where all individuals can be tested for free. Testing is one of the keys to reopening the state safely so that we avoid a potential second wave. To date, 489,359 tests have been performed. 17,668 were reported in just the last 24 hours. With the increase of testing around Illinois, for sure, there are an increase in positive COVID-19 cases detected. That is expected. But rather focusing on the large numbers of cases yesterday, one should take into account the very large amount of specimens that were resulted. And that is the win, that we are making more tests available to all people throughout the state, and we will continue to ramp up that testing capacity. The positivity rate statewide thus far is 17%. That means that for today, again, that was calculated on a 7-day rolling average. But that means for today, we looked at the number of positive and total tests reported from May 3rd to May 10th, because there is a 3-day lag. As of last night, 4,563 people were reported to be in the hospital with COVID-19 illness. Of those, 1,208 patients were in the ICU and 714 patients were on ventilators. Of course, we know that the numbers of the people in the hospital, the numbers of people that have passed on, they're not just numbers and statistics. These are real people, and there are families and loved ones who are suffering with each of them, whether in their illness or in their unfortunate passing. We together as a state mourn for all the lives that are lost, and we pray for everyone's quick recovery. You may not know someone personally who was sick with COVID-19. You may not know someone personally who has passed on from COVID-19. But please know that people of all ages are falling victim to this new virus. This is a real disease. This is a serious disease. It's not a hoax, and people need to take it very seriously. Please continue to stay home. Please maintain physical separation or social distancing. Please wear your mask. Please help us decrease the spread of this virus, and please help us save lives. Thank you so much for your attention. And with that, I will summarize comments in Spanish. Buenas tardes. Quiero comenzar reconociendo todo el trabajo que hacen los departamentos de salud públicas y sus trabajadores dedicados. Estas son las personas que trabajan todos los días para asegurar de que su comida sea segura cuando come en un restaurante, que investiga los brotes de tosferina y sarampión, dan vacunas para proteger a los niños de más de una docena de enfermedades prevenibles y mucho más. Los oficiales locales de salud están trabajando día y noche para mantener todos a salvo y están tomando decisiones basadas en la ciencia. Nosotros no somos el enemigo, el virus es el enemigo. Les pido que entiendan la presión que se encuentran estos trabajadores dedicados. Estamos trabajando para el estado de Illinois. Y con eso presentó el reporte médico de hoy. Hoy estamos reportando 1,677 casos nuevos de ayer para un total de más de 84,000 casos de COVID-19 aquí en Illinois. Hay un total de 3,792 muertes. 192 de ellos fueron reportadas en las últimas 24 horas. Desafortunadamente, este es el número de muertes más reportados en un solo día. Nuestra capacidad de prueba está creciendo en todo el estado y urgimos a los trabajadores médicos, policía, bomberos, empleados correccionales que hagan la prueba. También las personas con enfermedades crónicas y los que son empleados críticos como trabajadores de supermercados, conductores de camiones y cualquier persona que trabaja para un negocio esencial. Deben hacerse la prueba también. Hay más de 250 lugares de prueba en Illinois. Hay 7 sitios de prueba basados en la comunidad en todo el estado, incluyendo el más reciente que abrió en East St. Louis, donde esas personas pueden hacerse la prueba completamente gratis. La prueba es una de las claves para volver a abrir el estado de forma segura para evitar una segunda ola del virus. 17,668 pruebas fueron reportadas en las últimas 24 horas. Con el aumento de las pruebas en Illinois, hay un aumento en los casos positivos de COVID-19. Nosotros esperábamos eso, pero en lugar de centrarse en la gran cantidad de casos de ayer, uno debe tener en cuenta la gran cantidad de muestras que también se analizaron. El número de positividad en todo el estado es 17%. Desde anoche se informó que 4,563 personas estaban en el hospital con COVID-19. De ellos, 1,208 pacientes estaban en la unidad de cuidados intensivos y 714 pacientes en ventiladores. Una de las duras realidades de los ventiladores es que más personas morirán después de ser puestas en un ventilador de las que podrán salir. Es una enfermedad muy difícil. Estos no son solo números, son personas. Hay familias que sufren por su pérdida. Es posible que usted no conozca personalmente a alguien que estaba enfermo con el COVID-19, pero personas de todas las edades están siendo víctimas de este nuevo virus. Esta es una enfermedad grave y las personas deben tomarlo en serio. Por favor, quédense en casa. Usa sus máscaras. Mantenga su distanciamiento social. No contribuya a la transmisión del virus y no pongan en riesgo la vida de otros. Muchísimas gracias por su atención. And with that, I'll turn it over to Governor Pritzker.
Thank you very much, Dr. Ezike. Today, I want to update all of you on our work to support and protect the employees and residents of long-term care facilities around the state. This is our third recent update dedicated to this very topic, which we last covered 2 weeks ago on April 29th, as well as on April 20th. As you know, we have been focused on these facilities from very early in this crisis. Back in early March, long before we ever had a known congregate care case. As soon as we knew of COVID-19's adverse effects on elderly congregate communities, we implemented restrictions around visitors at facilities that we control, such as our veterans' homes, and worked with the state's vast network of long-term care facilities and their governing organizations to issue guidelines to implement similarly strict restrictions and protocols. Since then, as we've expanded our testing in Illinois, we've worked to prioritize testing at our long-term care facilities. As I announced on April 20th, IDPH is providing testing of all residents and all staff at facilities without known COVID-19 outbreaks, allowing us to potentially identify early the presence of COVID-19 in a facility and to isolate those cases before widespread transmission. IDPH is also providing tests for all employees at facilities with known cases, potentially determining who might be infected but asymptomatic, and instead of working, should be in isolation. And of course, as with all healthcare workers, staff at these facilities have had some of the longest standing access to testing in Illinois. IDPH has prioritized testing at long-term care facilities home to our vulnerable populations where a COVID infection is more likely to lead to higher severity cases, especially among communities of color. Since expanding our testing, we've provided 30,000 tests to 129 facilities around the state. In addition to the IDPH-driven testing efforts, the contractual partnership that I previously announced with Quest Diagnostics has been making deliveries to long-term care facilities since May 5th. Quest and IDPH are working to scale up those deliveries and maintain a 48-hour turnaround for results as dictated by the agreement. I also want to touch on PPE distributions to long-term care facilities across Illinois. Long-term care facilities join hospitals and other healthcare facilities in being some of the many thousands of entities that the state is supporting through PPE deliveries throughout this pandemic. Local health departments are the first line of communication and support for all of these facilities. The state has delivered PPE to all 102 counties and continues to do so, including local emergency management agencies, regional healthcare coalitions, and local health departments. Again, we rely upon local public health departments to deliver to each individual long-term care facilities needed. Our state stockpile always provides a backup for them and is not the primary supplier for private businesses, such as nursing homes. Having state government fulfill each individual request would not be efficient or in any way manageable. That said, these are some of our most vulnerable Illinoisans, and in this crisis, the state is doing everything in its power to protect them. So to assure that all facilities have their own stockpiles, IEMA and IDPH have coordinated a somewhat unprecedented effort to directly deliver PPE to more than 1,200 nursing homes and other long-term care facilities across the state. These shipments began on April 30th and have reached more than 85% of these facilities, with the final deliveries expected in the coming days. Each shipment contains PPE for managing 200 residents, and facilities with more than 200 beds will receive 2 shipments. These shipments include KN95 and N95 masks, surgical masks, gloves, face shields, hand sanitizer, and shoe covers. I want to remind nursing home facilities and their associations that to maximize the use of PPE, we've made available to them our new N95 mask decontamination system to stretch their PPE stocks further. This is a fully free service door to door. FedEx is handling the transport of masks from facilities to the decontamination site and back again. And the U.S. Department of Health and Human Services is covering all of the costs of using that system. Masks can be decontaminated up to 20 times without experiencing any reduction in performance. Facilities can contact IEMA to schedule pickup. The vast majority of Illinois' long-term care facilities are private entities, but our four veterans homes are state operated. So I also want to take this moment to walk through what these efforts have looked like at our facilities: Quincy, LaSalle, Manteno, and Anna veterans homes. On March 5th, these 4 facilities were required to begin screening all employees and all visitors before entry into the home. By March 10th, still days before our first known case at a long-term care facility, that directive was elevated to stop all vendors from entering the facility, put an end to all off-campus resident activities beyond critical medical appointments, restrict all family visits except for end-of-life events, end all construction projects at facilities, and modify dining protocols, including implementing in-room meals wherever possible. These restrictions have evolved contemporaneously with IDPH and CDC guidance, including the masking of all employees at facilities and the expansion of employee screenings to 3 times per shift, including the logging of temperatures at the beginning, middle, and end of a work period. As of yesterday, all of our residents and employees at our state's 4 veterans homes have been tested for COVID-19, and the status of each home I'm about to share is as of this morning. One of the 153 residents at LaSalle was found to be positive earlier in May. Subsequent testing revealed no additional positive residents and no positive results among 219 staff members. At Anna, full facility testing revealed 5 positive residents among 51, with all results back as of yesterday. And as of yesterday, none of the 78 staff were found to be positive, though a handful are still awaiting results. At Manteno, 30 residents of 220 and 19 employees out of 307 were found to be positive at various periods of testing between April and May. All residents were tested over the last few days. All positive residents and all residents they had direct contact with have been isolated. At Quincy, there are no known positive residents or staff to date. As of this morning, 50 residents and 250 staff tests have come back negative. 289 residents, as well as more than 50 staff were still awaiting their results from DPH. Additional testing of about 300 staff and contractors is ongoing. I'm also saddened to share that a Manteno Veterans Home resident who had been in hospice care for several months for other conditions recently tested positive and has passed away. To the family members and loved ones of this hero, a person who served and sacrificed for the America that we all cherish, God bless you. My thoughts and prayers are with you. In this global battle for public health, the heroism of our veterans is more salient than ever. May we forever share their faith that the people, places, and values here at home are worth fighting for. The staff at all of our veterans' homes continue to operate with extreme vigilance in ensuring the safety of our nation's heroes through this crisis, adhering to best recommended protocols and isolation practices as determined by IDPH and other public health experts. It is these same guiding principles that my team and I encourage and expect of the private long-term care facilities that exist to serve seniors across the state. And it is in accordance with those principles that we will pursue any bad actors to the fullest extent of the law. I want to remind everyone that anyone, from an employee to a resident to an outside family member, can file a complaint with IDPH about an issue at a long-term care facility in Illinois, COVID-19 related or otherwise. And to the many thousands of healthcare workers and caretakers who spend their days caring for Illinoisans in these facilities, our veterans, our grandparents, our elderly neighbors and loved ones, thank you for all that you do to serve the people of this state and especially those elderly loved ones. Before I take questions from the press, I want to briefly address some of what we've been hearing lately from those who believe that we need to reopen faster than the science and the data dictates. Folks, I know this is hard. I know that people are hurting. This virus has taken many lives and destroyed many livelihoods. COVID-19 has turned our world upside down and stolen our sense of normalcy and stability. I want this to end just as much as you do. If I could take away the pain and the loss that you're feeling right now, I would do it in a heartbeat. But this virus is still among us. This pandemic is not over. And to pretend otherwise in a misguided attempt to reclaim what we've lost will only make this last longer. For leaders, there are no easy decisions in a pandemic. Every choice has consequences. And I know leaders across the state are struggling with these choices. And I have sympathy for them in that struggle. But what I don't have sympathy for is those so intent on disregarding science and logic, so afraid to tell their constituents what they may not want to hear, that they put more people's lives at risk. Here's what I want to say to those leaders. You weren't elected to do what's easy. You were elected to do what's right. To the small minority of businesses that choose to ignore the medical doctors and the data and to ignore your legal obligations to the residents of your communities, there will be consequences. Businesses and individual professionals that are licensed by state agencies will be held accountable for breaching public health orders. Counties that try to reopen in defiance may not be reimbursed by FEMA for damages they cause because they ignored the law. Local law enforcement and the Illinois State Police can and will take action. But there is no consequence the state could impose that is greater than the harm that you will do to your own communities. 192 Illinoisans lost their lives to this virus in the past 24 hours. 192. How is that not real to you? More people will get sick, get admitted to the hospital, and die if we don't stay the course and follow the guidance the experts have provided. To the elected officials out there who are playing to the crowd that ignores science and carries symbols of hate. Step up and lead. Now, more than ever, your communities need you. Don't let them down. One last thing before I take questions. I want to address something that I said yesterday regarding baseball and baseball players. I want to apologize for leaving the impression that baseball players shouldn't have the right to bargain to protect their health and safety. I absolutely support that right, and I should have made that more clear. Thank you, and now I'd be happy to take any questions from members of the press.
Eric from ABC7, we'll start with you.
Hi, Governor. Good Wednesday to you and to Dr. Ezike. Downstate Madison County and Adams County have both authorized their own reopenings. You sort of referenced that this just now, but other than withholding federal funds, what other enforcement mechanisms are you considering, and have you ruled out sending in state police?
Well, not just federal funds that we're talking about. As I just said, the businesses that ignore the executive orders, that ignore the law, will be held accountable by our Department of Professional Regulation, and will be held accountable by any licensing body, Liquor Commission, Liquor Control Commission, and others. So there are enforcement mechanisms here that we will be using against them. And I would again implore the leaders of these communities not to give in to the minority of residents who are clamoring to ignore the science and the data, but instead to follow the rules, to follow the law, and most importantly, to keep the residents of your communities safe.
Yeah, Greg Bishop from the Center Square has sort of a follow-up to that statement. What additional damage, though, would be done to local communities already reeling from the economic downturn if federal funds are withheld by your administration, if regulation gets involved and takes away some of the licenses of these business owners? I mean, these are folks that are already hurting. Who bears responsibility if their hardship gets even worse?
Well, they're the ones who bear the responsibility because they're the ones who are not following the rules. Let's be clear. What we're trying to do here is keep people healthy and safe and to reopen the economy simultaneously. And that's what the restored
Missouri National Guard. They've been in here this week while the legislators have been here working the doors and helping with that, along with the many other duties they've got across the state. And I just every day I just appreciate the men and women that work for the Missouri National Guard and the jobs they do every day. So I want to take time to thank them today. The data continues to look more positive for Missouri, and I want to review some of that data with you again today. Missouri has tested over 124,000 Missourians since the COVID-19 pandemic began. Last night, I read a report where Missouri had 10,000 positive cases. That is inaccurate information, and I think the public needs to understand that. The 10,000 number is a cumulative total since we started on March the 7th. And I will keep repeating that because I think it's important everyone knows that. The reality of it is most of those 10,000 have recovered or are recovering. There's about 9 to 10% that would still be affected with that. So you can do the math on that, but the majority of those people have recovered from that. So I just want to make sure that everybody gets that information. It's not misleading, that everybody in Missouri understands that those numbers. That is Missouri's total. Many of those positive cases have been recovered or are recovering. And today we had an increase of 136 positive cases. The deaths are at 542. And again, saddened for every family member and every friend who have lost a loved one. Testing has been a primary focus of the pandemic. We knew testing capacity would give people the confidence needed to get back to a more normal. My administration and I have worked hard to get our testing in a good position. One of the major pillars to reopening Missouri is expanding testing statewide, which we have been doing and continue to work to increase capacity. As we build the state's testing capacity, it's going to be critical to strategically deploy new testing resources. This includes tests for comprehensive testing of symptomatic and asymptomatic people among outbreaks and antibody testing to look at disease prevalence. Therefore, a cross-agency working group has identified a number of priorities of how the state of Missouri can prioritize and deploy testing resources that flow through state administrative channels. These priorities include the early identification of possible outbreaks through the use of community sampling, sentinel testing, and for vulnerable populations, the rapid deployment of testing supplies and support resources as localized outbreaks are identified, expanding access to testings for vulnerable populations, healthcare workers, first responders, workers in critical industries, and long-term care facilities are extremely vulnerable. And we plan to move on the box-in strategy for these facilities. Just as critical as the testing supply themselves, the support functions around test collections, the staffing, the PPE, and the need for contact tracing are critical. The cross-agency team working on testing and building plans to address those challenges. We also know that primary care providers will play a critical role in recommending citizens for testing. It is essential that doctors and clinics review the expanded testing guidance put out by the Department of Health and Senior Services to ensure not only that we've identified new cases, but have helped individuals get tested who work in essential industries and whose employers may require tests before they can return to work. It is also very important that Missourians who have symptoms or who have had close contact with a confirmed positive case to contact their local health care provider to discuss testing options. To protect our families, our businesses, and our citizens, we have to ensure access to testing and follow responsible social distancing requirements. Today, we are fortunate to have Jim Dumbald here, a senior director from Quest Diagnostics, with us today. Quest Laboratories has been an integral part of bringing testing capacity to Missouri. We have talked about Quest, it seems like a lot in our briefings early on about these companies, and I can't tell you what that's meant for the people of the state of Missouri and what they've brought to the table here for us in Missouri, but we're grateful for Jim's here today. His wife is also with him today, that's out in the audience out there, a retired school teacher, so we're glad she gets to be part of this, but we're glad to have both of them here. Jim?
Thank you, Governor. I appreciate it. First off, I would just like to thank Governor Parson, as well as his staff and the citizens of Missouri for the support that they've given us, Quest Diagnostics, in terms of the testing and our ability to service Missourians. You know, we look at testing sort of as a team sport, or look at it in a way that is like a team sport, and that is it takes the collaboration of a number of people to make sure it happens correctly. And so whether that's public or private sector, working together does help the situation and help us through the crisis. We're proud to be an integral part of the community in Missouri. We have over 1,200 employees working in Missouri. We have 34 patient services centers. Last year we did over 900,000 tests in Missouri alone. Missouri, we have over a dozen relationships with hospital, healthcare systems, community health centers, and the VA hospital, just to name a few. Fitzgibbon Hospital, Mosaic Life Care, Truman Medical Center, Mercy, State of Missouri Department of Health and Services Community Study, St. Francis Medical Center, Phinia Health, ESSA Health, Total Access Urgent Care, Freeman Health System, Harry S. Truman VA Hospitals, and finally a Jordan Valley Community Health Center. You know, a little bit about Quest Diagnostics in terms of the logistics, my function. I actually serve over 1.3 million square miles in the United States, 19 states. I have over 800 vehicles running in those states, making pickups of our specimens and bringing them back to our testing labs. I have 9 aircraft that we own and operate that help us move those specimens in those 19 states. And we've made over 3 million stops, that's a client visit, each year. And we travel over 26 million miles per year. So we're kind of in and around, and we really lubricate the methods in terms of collecting specimens and getting them into our labs for testing. Nationwide, Quest has performed over 1.5 million COVID-19 diagnostics tests since March 9th. And we are currently have a capacity of over 50,000 tests per day, and we're ramping that up as fast as we possibly can. We hope to be at somewhere in the neighborhood of 100,000 within the coming weeks or month. So we're really trying to support Missouri as well as the nation in terms of our testing ability and the ability to get through this crisis. I would like to give thanks for the opportunity to speak here to the citizens of Missouri. We're honored to support your efforts, and stay safe, and we're happy to be part of this journey. Thank you.
Jim, thank you. Thank you again for being here today. For all of us that didn't know much about Quest or knew about testing before this all started, as many of you here today have walked your way through this and learned as we went. It was so important for those companies to be out there that we could rely on, that stayed functional, stayed working every day to make sure we could keep accumulating those tests every day till we get better and better at it. So I thank the companies that were out there on the front lines working every day to try to get those tests back as soon as we could. You know, testing is and will continue to be a key ingredient to moving forward. Missouri is moving in the right direction. Tomorrow, I am heading to the southeast part of the state to see how they are gradually reopening businesses and industry. And I will also get the privilege of thanking law enforcement officers for their dedication and commitment to the people of this state. We must continue to remember to social distance and use good common sense if we're to win over this virus. I told people earlier today, some of the people I'm on the phone with, the one thing I do know for Missouri to move forward, and I've said it time and time again, but I'm going to say it another time. In order for Missouri to move forward, we have to be able to fight this virus, and we have to be able to get the economy going at the same time. Those two are going to go hand in hand, and we're going to have to do that for a longer period of time than maybe any of us want, but those two things have to go together. So thank everybody for being here today, and God bless Missouri and the people of this state. Kelly?
Sure.
All right, Crystal from the Kansas City Star. Hello. So you said that Quest does 50,000 tests a day. Do you know of what percentage of those tests are just Missouri tests?
Actually, I don't have those figures at hand. We do approximately 50,000 or can do 50,000 across the country, but I don't have the exact Missouri number.
Are you pretty much at your maximum capacity for testing, or can you expand more if you needed to?
No, we can expand more. Currently, we're a little bit short of our maximum capacity right now. We do move testing around to maximize the throughput at our labs so that we can achieve a good turnaround time on testing. But we plan on ramping up our testing, as I mentioned, in the next weeks, in the next month, to what we hope to be 100,000 tests a day.
Hi. So you say the capacity right now is at 50,000. Are you doing and you say you can do that amount. How many tests are you do you per se you're pretty much doing right now?
The last number I saw was actually from Monday, and I believe it was about 48,000.
All right, thank you, Mr. Gumbel.
Thank you.
Director Williams?
Yes.
Hi, Dr. Williams.
Hey.
I had a question based on what Governor Parson said, that we have just over 10,000 cases and about 542 people have died. That would be at a death rate of about 5%, correct, if my math is right? I know that's of people tested, but does that seem unusually high?
Well, we look at it per capita is the way we do it, and we look at it compared to other states. And so the last time I looked at it, we were below average in the United States for deaths per capita for the number of people, if that answers your question, as opposed to deaths per number of tests. But we track that every day. It's on our website. I believe you can see it with the new robust website. It's deaths per capita. I just want to add, just cannot thank Jim for being here and enough for what they do. You know, as I've said before, I think that public health at its best is a force multiplier, and it was always our strategy to emphasize testing and to use our commercial labs. And so the question Jim asked, we watch it I see every day how many tests Quest does in Missouri as opposed to in the other 17 labs. And their days, they do 3,000 tests a day in Missouri. Their average is probably around 1,000 to 1,500. Not right now because our cases are so much down. We've had 74 on Monday, 86 on Tuesday, and 136 today. Also, part of that, as he pointed out, is our hospitals. This is National Hospital Week. And the governor and I were on a conference call, as we always are on Wednesday for the last 10 weeks or so, with our hospital partners, and just cannot thank our labs and our hospitals and our local health departments and our more than 150 testing sites for getting us to where we are to do the robust testing we're going to do and be doing more so in the future. As the governor said, people say public health or economy. That's a false choice. They're both correlated. You have to have a good economy to have good public health, and you have to have good public health to have a good economy. Those are very much intertwined and integrated, and that's very much our thought going forward.
Between all the labs in the state, what is the current daily testing capacity in Missouri?
Well, capacity right now, I look at it every day, we're over 60,000. It's about whatever 7 times about 8,800 is when I looked at it this morning. And I just got off a phone call with Admiral Giroir at the White House about an hour and a half ago. He said that, and he mentioned Quest specifically, that they believe that they will increase their testing capacity nationwide 500,000 tests a week. I believe it was by next week. And I think I've heard some questions about testing materials. As you know, we got 29,000. Crystal had asked me about that, and I think we told her we got 29,000 swabs on this weekend. We've pushed the majority of those out to hospitals to help them as they open back up, and we've been told that we will get those every week now for the next coming weeks. Admiral Giroir said on the phone today that in the month of May they will send out to the 50 states 9.9 million swabs. And so every week we will be reporting out how many more swabs we get.
So when you say 7, you mean 7 days and 8,800 tests per day?
Yes.
Okay.
Mm-hmm. Mm-hmm.
Hi, Dr. Williams. I was just wondering what you know about inflammatory syndrome in children and how many cases have been treated in Missouri?
I don't know the exact number. I know we've had some in Kansas City. They've had 150 in New York, I believe. It's an interesting, it's thought to be associated with COVID-19. It's an autoimmune reaction. We've seen it in other diseases, one called Kawasaki's. And it's basically where your body reacts to itself. It reacts to an antigen and starts attacking itself. And we've seen that in some other conditions like Kawasaki's disease in children. And it's there's not a cure for it. What you have to do is go in and just try to support the body till it can recover from the autoimmune attack of attacking itself. But I don't have an exact case count in Missouri, but we have had some cases in Kansas City and in St. Louis.
Is there anything that parents can do to maybe protect their kids at this time? I know we don't have a lot of cases.
Yeah, not that I'm aware of. One thing we looked at, less than 2% of our cases in Missouri have been in individuals under age 20. So right off the bat, we're thankful that the denominator of children affected is so low. But what it is about, every parent would want to know. I remember when I practiced medicine, why my child? Why did my child get this incredibly rare thing? And to date, I don't think we have that answer.
Hi, Dr. Williams.
Hey, Jeff.
Could you just sort of summarize for Missourians what the strategy is for using testing in the best way possible going forward for the state?
Yeah, I think the governor summarized it great. The first is we've expanded our testing criteria. So if you're symptomatic in any way, or if you're even asymptomatic, but I was out in Affinia on Monday, and people were coming to get tested. And I said, "Why are you getting here?" I said, "Well, I had a loved one who had it, and I'm worried about it, or I work in a healthcare facility and I want to get checked." So these people were out in a parking lot on a Monday afternoon or Monday morning, and we tested them. So we want to test all those people. We have the capacity to do that now if you have that concern. The second bucket is going to be this boxed-in strategy where we go into long-term care facilities. We're changing our criteria. If you have one patient who turns positive or one staff member who's symptomatic who turns positive, we're going to go in and check everybody. And we're going to do the same. We're going to also be doing very similar in our prisons, jails, meatpacking facilities. So you've got that bucket that we're going to be doing. And then we're also going to be doing, as the governor said, sentinel testing. As we get into June and July, and we're going to have less cases, I believe, we're going to go into our long-term care facilities and our meatpacking plants and pick sporadically groups to test, 10% of the people, just to see, as the governor said, are there any things developing that we need to check? Because one thing we learned in Triumph is there are people who walk around asymptomatic, and we want to see if we can figure out who that is before it is. The next bucket is prevalence testing, where we will just go into communities like we did 2 weeks ago, all across the state, and just check people and see what is the prevalence in Missouri in mid-July. And we'll use antibody testing for that, and we'll also use PCR testing. So it is broad, it is widespread, and it's going to be incredibly robust. And we think that gives us the confidence to open up the economy and to keep people healthy. Because as I said before, and the governor has said many times, they're related. They go hand in hand. To have a good economy, you need healthy people. To have healthy people, you need a good economy. Thank y'all.
To piggyback off of Jeff's question, actually, will there ever be a time, the strategy you just described sounds like you'll be going into specific areas to kind of facilitate the testing, but will there ever be a time where residents of Missouri could just get a test if they want to see if they've been exposed to the virus, have the antibody? What would that look like?
Yeah, I think, by June, July, if you want to go in and get an antibody test validated by the FDA, you'll be able to. And I think many people do it. I will do it. I'll go in July or so just to check and see. Now, you're going to hear people say, well, we don't know that conveys immunity. But most of the time, we believe with other disease states, if you have antibodies, that's a positive thing. And I think I quoted to you the study from Mount Sinai 2 weeks ago that showed even people with mild disease, who just are barely sick, if you wait 3 weeks, the vast majority, 99%, will have an antibody response.
In the scenario that you were posing about someone being worried about exposure to COVID and being able to get a test, in that scenario, would a person still have to contact their primary care doctor to have a test ordered, or would they be able to go to a public health department and get a test?
Yeah, Crystal, it's changed. I mean, right now, the FDA's approved an at-home test. Pretty soon, you're going to be able to do your own test. Matter of fact, if you can get one now, it's been approved by the FDA. So you're going to see that coming forward. You're seeing saliva testing. We don't think that's quite as accurate as the nasal swab, but you've heard people talking about just doing the cheek yourself and doing your own test. So I think the day's rapidly coming in the next 2 or 3 weeks where you'll have the ability to test yourself. We probably would recommend the nasal swab instead, but I think you'll have that capacity, and I think within the month, anybody who wants to get an antibody test will be able to get one, a blood draw, and just see what your status is. Yeah.
Hi, Dr. Williams.
Yes.
You mentioned the prevalence testing. I'm just kind of curious, how, when you go into a community, one, how do you select the certain community, and then how do you select the people? Like, do they volunteer, or kind of what's that process?
Yeah, it's a good question. It's epidemiologic, and what you do is you go in and you do a cohort, and so you start look. It's like polling, where you try to find a representative group of people by demographics, and that would be race and age and sex. that represents an area, and you say, we think these 500 people are representative of 100,000 people, we're going to specifically check them for their demographics, and then we'll extrapolate from that what the prevalence of COVID-19 is. Is it 5%, which some people think it is, that have antibodies? And so it's different than what we did earlier, which was just a snapshot. We did not match people up by demographics. But in a true randomized prevalence study, we actually are extrapolating from them what the broader population looks like. And our plans are to do that in about 3 weeks, I think. Thank y'all.
Just one thing to add on to what Dr. Williams just said too about testing as these numbers grow, and it's going to be more apparent that people are going to be a lot more available to get a test. But I think it's also important to remember the demand for testing has also went down as far as on the private sector, unless you're in kind of a hot spot or some of the things we're doing. So I think that's important as we move forward and things get a little better. I think people are going to be less likely to want to be tested. The good news is, though, we're going to be very aggressive on the testing from our part of it, trying to push those testings out to make sure that we get those tests done. The other thing, when Jim was up here from Quest talking about testing, we had one company that was up here, and I think as today we talked, we're probably utilizing 7 or 8 different companies for testing along with the state lab. So those numbers, when you hear what Quest is doing, then you look at all the other companies that are doing that the hospitals may be using or the private sector may be using. So those numbers are growing every day as we do that. So, questions?
Governor, there was a widely reported federal government document that noted that Kansas City might be a hot spot to watch for coronavirus cases. And so the document identified Missouri as a place where new coronavirus cases had grown on a week-over-week basis, or 31%. Do you know what accounts for the growth in Missouri cases? And given the increase in cases in Missouri, does that give you any pause about loosening restrictions and reopening the economy?
Yeah, well, first of all, I wouldn't put much stock in a report from outside the state of Missouri, which we've proven all through this process that most of that's inaccurate information. So I don't know what study you're referring to, even how accurate it would be. I do know this: Kansas City's done an extremely good job of taking care of the coronavirus up there, as you can see, compared to other cities its size, and you can compare it to St. Louis. They've done a good job up there. So the mayor, their health department, and the people up there has done a really good job in that Kansas City region. Not to say they didn't have problems like everybody else, but they're well on the way to recovery, and I think if it keeps going, you got to keep that in mind. Here's the other thing: there is going to be spikes from time to time, and this is going to happen. Whether it's a nursing home, whether it's people congregate, that's going to happen eventually, sooner or later. But this virus is still out there, and I want to stress that to every day. That's why social distancing is such an important part of how we fight the coronavirus. You have to keep that in there. But Kansas City's done a good job for their size. I think they're very fortunate. They've done a good job up there.
Just to follow up with the inflammatory syndrome in children, is that a concern for you as we're starting to reopen and kids may go to summer camp, but in the fall as the school year approaches?
Yeah, I mean, with the Department of Health, we're looking into that right now because, we're concerned about all that. We've been very fortunate so far. It hasn't affected our children like we thought it was. And again, I go back to when this all began. None of us knew who it was really going to target so much. We didn't know whether it was going to be, whether it's our seniors with underlying health issues or whether it was going to be children or middle-aged. We didn't know. We do kind of know that now. So when we see something like that, again, that's one of those daily things I talk about change. So we want to check in that and get as much information as we can, as I know other states are too. But anytime we start seeing a different spike than we've seen, we're always taking a look at that, and we want to try to find out, get to the bottom of it as soon as we can, to prevent it or do whatever we can from our perspective to help with it.
Governor, we're beginning to see universities in other states cancel their in-person classes for the fall. Is the state here giving any advice yet to our universities on that?
We have not. You know what? I actually plan on meeting with the president, the university, the community colleges, DESE in the next week or two to talk about different things, to talk about funding and talk about how that fall might look. Again, I think it's early. We're at the middle of May, but we still got to be able to look and see how this is going to affect the state and how it's going to affect our citizens and how that's going to be. I'm not for sure we got the information we need to make that decision right now. I think come June the 1st, you're going to get a little clearer picture of what's going to happen in the state, whether we're going to have school as normal or what we're going to do. But again, it's just going to take a little time to really realize where we're at on opening up schools and things like that.
In terms of the state budget, I know the lawmakers mentioned that they left some flexibility in the budget for the federal dollars, but I know at the federal level there's also talk about more stimulus money. Do you anticipate a special session being called later in June or this month?
Well, it all depends what the federal government does, if they do anything. You know, from here at the governor's office, we got Plan A and Plan B. Plan A right now is moving forward is that we're not going to get any more federal money. So we're preparing for July, what those withholds might look like and what we're going to have to do here in the state. And the second thing, again, depending on what the federal government does, if they do anything. You know, we'll see what that backfill is. But I don't know it'll be a special session because I just don't know what that is right now. Hopefully we'll be able to address that issue. If not, look, we're going to have to withhold hundreds of millions of dollars by July the 1st if we don't.
This is the last week of legislative session, and the lawmakers are working beyond the budget. Do you have any comments on things that they are doing or session so far amid the coronavirus?
Yeah, you know, one of the good things that they got out early, I understanding, is reciprocity. That's probably going to be a national leader in what we did on reciprocity for our state. We did military reciprocity, was one of the first issues they got out. They got full reciprocity out. I think that's a much bigger deal moving forward than maybe people realize now with the coronavirus kind of being in that front page of the news, I guess. But the reality of it is they got that done. I know they've got a couple other bills done so far. You know, I'm not sure what they'll finish at the end of the line. You know, you're in the last 2 days of session, and I've sat in those seats before. There's a lot of things will happen tomorrow and Friday, or nothing will happen. I don't know which. But anyhow, it's a little early to kind of try to figure out what's going to make it across the finish line. And I think it's also important for especially the people, you know, watching this today, you know, to realize just because something gets passed in the legislature, you know, you don't know what all's in that bill. And I've always been hesitant to say, would I sign a bill, would I not sign a bill until I see what all's in it? Because, you know, there's basic things they got to be. They got to be constitutional. They got to, you know, make sure there's not a Hammersmith problem in there. So we'll discuss that after the session's over and see what ends up on my desk.
You mentioned we need to fight the virus, but also kind of stimulate the economy. And on Monday, you mentioned we need to focus on how to create jobs.
Right.
I was wondering, what type of jobs do you anticipate will be created?
Yeah, well, I think things is, you know, you may have things like right now, online services might expand. You know, deliveries may expand to a different modes out there. Healthcare may be a different way we give healthcare to people out there. So I think whether it be telemedicine, I think different things with technology will probably change the way we do business. So I think that'll be opportunities for people to be able to look at that. You know, I mentioned yesterday that we were really excited about when actually the federal government called and was talking about manufacturing in our state of Missouri, making PPE supplies and gear. You know, that we were kind of I want to say a leader in the United States when it come to the Google Marketplace that we developed here, and it really combined our medical teams with our manufacturers. So that become a little bit of a model the rest of the United States is looking at. So I think there's opportunities for manufacturers to come in to make PPE gear. I think whether it's technology, we're going to change the way we do business. But you know what? I firmly believe people are going to go back to work. Businesses are going to want to come to Missouri. I can tell you, as of last week, we got a call from a business of about 160 people in Illinois. Believe me, they want to come to Missouri, and they're trying to figure an avenue how to get here because of just what's happening over there and some of the things they're going to. So I think there'll be opportunities with it. Slow going, but I think you'll see people come, and I think Missouri is just a solid state where people's going to want to do business in this state. All right, thanks everybody for being here today. Thank you.